Hello friends, we are going to discuss some important points for NEET PG. First, acquired depigmented lesion. Acquired depigmented lesion. Acquired depigmented lesion. First is vitiligo. First is vitiligo. Go means जो चले गए, so loss. So loss of melanocyte, absence of melanin, absence of melanin. What is the poor prognostic factor for vitiligo? Poor prognostic factor for vitiligo. Number one is vitiligo on bony prominence. Vitiligo on bony prominences. B. Leukotrichia. Leukotrichia. Leukotrichia means non-hairy area. Why it is important? Hair has melanocytes. So, in non-hairy areas, there is lack of melanocytes. It is a poor prognostic factor for vitiligo. Next, leukoderma. What is leukoderma? It is a depigmented lesion due to some chemical exposure. Due to exposure to chemicals. So first is para-tertiary butyl phenol. Para-tertiary butyl phenol. PTBP. It is pati. Indian woman wears bindi her pati. So it is in bindi. Next, P phenylenediamine. Seen in dia. So here dye. Dia dye. Next is monobenzyl mono monobenzyl ether of hydroquinone. Ether of hydroquinone. Seen in rubber slipper. Rubber slipper. Next important point is there's three terms. Ichthyosis vulgaris. Ichthyosis vulgaris. Vulgaris mean most common, and it presents like fish-like scales. Fish-like scales. And it is not present at birth. It is not present at birth. Next term is lamellar ichthyosis. Lamellar ichthyosis. What is this? This is a lamella or membrane covered the baby. This membrane is also called collodion membrane. Collodion membrane. This membrane is also called collodion membrane. This is lamellar ichthyosis. Next is harlequin ichthyosis. Harlequin ichthyosis. It is the most severe ichthyosis. It is the most severe ichthyosis. Most severe. Fetus die in uterus. Harley means hard or bad. So it is the most severe. Harley Quinn is hard means bad. So most severe fetus die in uterus. Fetus die in uterus. Next, there is two term that is scleroderma. Scleroderma and scleroderma. Scleroderma. Scleroderma is also called, also seen in, scleroderma is seen in Raynaud's disease or Raynaud's phenomenon. Raynaud's phenomenon, also called sclerodactyly. Scleroderma associated with diabetes. So how we can remember it? Sclero, O resembles like A. This is Raynaud's phenomenon, and here is O. But in E, scleroderma, there is E. In diabetes, there is no O. There is no letter O. No O letter. So there is no O letter. Like here, in Raynaud's phenomenon, there is no E letter. So scleroderma seen in Raynaud's phenomenon and scleroderma associated with diabetes. There is another MCQ from Raynaud's phenomenon. The changes the of color seen in Raynaud's phenomenon, that is PCR, pallor, cyanosis, next rubra. This is skin changes seen in Raynaud's phenomenon or Raynaud's disease. Next, self-limiting disease in Dharma. So, self-limiting disease in Dharma. First, pityriasis rosea. Pityriasis rosea. Next, erythema multiforme. Erythema multiforme. Next, erythema nodosum. Next, melasma. Next, lichen nitidus. Lichen nitidus. Lichen nitidus. So why these are important? They give MCQ from this disease. What is the treatment? There is no treatment needed because they're self-limiting disease. Pityriasis rosea, erythema multiforme, erythema nodosum, melasma, and lichen nitidus. That's all.